What does the road ahead look like for patients with SCAD?
That's a great question. Obviously, the road ahead is very different for each patient and may very well depend on what complications of SCAD each patient has experienced. Um, However, I think as a general principle, we know that majority of arteries that have SCAD tend to heal on their own without intervention with stents or with open heart surgery. So we know that typically by about somewhere from between 1 and 3 months, majority, almost 90%, and in some cases 95% of the arteries have healed on their own. Open heart surgery and stenting is typically done when the heart attack is diagnosed in hospital, and usually in cases where the patient's life is at extreme risk, the artery is totally blocked, and leaving it alone would compromise a significant portion of heart muscle. Or if there are abnormal arrhythmias that are life-threatening as a result of that blocked artery, or if there's extreme pain, and so on and so forth. So the road ahead very much depends on which pathway a patient has gone down, whether it's been intervention with stents and surgery, no intervention with stents or surgery.
And I have another one, Doc.
Sure.
It's like, how frequently should I be seeing a cardiologist or my family doctor?
So I believe this depends on, again, the complications or the consequences of one's SCAD event. But at minimum, most patients are seen within sort of 6 to 12 weeks after the SCAD event by a cardiologist, and usually at least once more during the first year. And often they have annual visits thereafter. With respect to how often to see your family physician, not just related to the SCAD, but there may be other reasons to see the family doctor, but usually at minimum twice within the first year of SCAD. It may be more frequent depending on the consequences of the SCAD event.